Thanks for watching On Call for All Kids. Today we're going to be talking about family travel over the holidays. We'll get questions answered about COVID-19 safety travel tips if you must travel, advice for traveling by cars, planes, and trains, and other medical considerations to think about before traveling. I'm joined by Dr. Ebony Hunter. She is an emergency medicine physician at Johns Hopkins All-Children's Hospital. And Dr. Hunter, we're so happy to have you here today.
It's good to be here. It's nice to see you, Ashley.
So we know that COVID-19 cases are still surging right now. The pandemic has not gone away, but here we are and the holidays are here. While we're certainly not encouraging travel, if you must, though, travel with kids, what are some considerations to keep in mind for families?
So again, I want to reiterate what you said. We are definitely not encouraging traveling during this holiday season as we still are at the peak of our COVID-19 pandemic. If you must travel for any urgent or emergent reasons, then I recommend that you have your children wearing masks and practicing safe social distancing. If you have smaller children or children you don't think will do well with the mask, practicing at home pre-travel in the mask so they are getting used to the mask is very important. Also, keeping wipes and hand sanitizers readily available so that they are easily accessible and able to clean your children's hands and yours too. Also, pre-packaging lots of snacks and things that you would normally stop to get would be a very helpful thing to do. Your basic thing is that you want to minimize as much social contact as possible if you must travel.
What are some things for families to keep in mind, even when you're traveling in the best of times, say when there's not a pandemic going on?
So things to consider really depend on your mode of travel. If you're traveling by car, for instance, you want to make sure you have the proper safety seats for your child based on your child's age, weight, and height. There are different things to consider if you're traveling by plane or train.
So, Dr. Hunter, you mentioned planes and trains. What are some tips and advice for parents who are flying or possibly traveling by train?
The main difference is that you lose that flexibility of being able to stop if you forgot something or pull over if you need to change a diaper or if your child's having a meltdown. So you kind of want to plan ahead for things that you may need. You also want to pack different things that you think you would need in the event of emergency since you don't have that option to be able to stop.
And what are some medical considerations before traveling?
Ideally, your child should have all their immunizations prior to traveling. Also, if your child has any medications that they take regularly, having those medications with you when they travel is important. I always like to tell families when packing medications, pack about a 48-hour additional than what the trip will be. That way, if there's an accident and you happen to drop a pill or amount of medication, or if you have any travel delays, that you'll have enough to get you through the trip. Also, if your child's on any rescue medications, such as albuterol, glucagon, EpiPens, having those on your person or on your carry-on readily available in the event of the emergency is very important. If for some reason you happen to run out of medications and you're in a different city or state than what your provider is in, it's important that you notify your provider before the last dose. You can call your provider and tell them to call the medication into any national pharmacy. That way you can get the prescription you need for your child.
Should families prepare for any other accidents even beyond that?
Families could prepare, but it's going to be hard to prepare for everything. You're going to drive yourself crazy trying to prepare for everything. I think the most important thing is looking up any local hospitals or clinics that treat pediatric patients in the event of emergency and just knowing where to go if there is an emergency.
How about if a parent has a child with special needs? What should they do to prepare?
So it depends on the need. If it's a medical need, having a card that lists your child's name, date of birth, diagnosis, medications, allergies on that medical card, and having it readily available is really helpful. And that way you can give it to whomever in the event of an emergency. Also, if your child's need is a medical need, having an emergency travel medical plan, which is given to you by your provider who's treating your child, is very helpful. And what that plan shows is what's your child diagnosis and what emergencies could arise with your child's diagnosis and how they want to continue treatment in the event of emergency. This happens a lot with our genetic kids and with different things such as sickle cell, HEMOC patients, different things like that. And what that does allows for the provider who is going to treat your child in the event of emergency to be consistent with whatever care that they were receiving at their home facility. And so there's consistency in the care and your child is being managed appropriately. If your child is immunocompromised, we do recommend that you get approval to travel prior to even traveling.
I'm glad we talked about all the children with certain medical needs. Are there any other needs that we should consider?
Absolutely. There are children with developmental needs, and they have a different set of considerations when traveling. Children who are on, such as autism spectrum, or have any type of developmental delay, you would need to consider different things, such as what things they like, such as a blanket, or light, or noise, or things that keep them calm. Because anytime people are children with developmental delay travel, and they're out of their normal surroundings, they can get a little overstimulated and have difficulty with that trip. So planning ahead to make sure you keep them as comfortable as possible by providing some consistency is really nice. The other thing is that if they have speech, occupational therapy, or physical therapy appointments, notifying their therapist that they will be on a trip and seeing if they can have a virtual session while you're on a trip is a really nice idea, as it keeps that child's therapy consistent, which is very important for children with developmental needs.
Any last thoughts, Dr. Hunter, on anything else we should consider when traveling this holiday season?
Actually, yes. There is, this may seem a little odd and specific and maybe even a little weird, but when traveling, kids are more prone to constipation. That's because they're out of their norm. They eat different diets. Some children just don't want to stool outside of their own home. And so, kind of monitoring that. And the reason why I bring this up is because abdominal pain is one of the primary reasons to go to an emergency department. And so treating that constipation, if they should have it, are preparing for that to prevent constipation while on a trip is very important. And so packing maybe a child approved stool softener or making sure that you increase the water and high fiber diet when on vacation is important and can possibly keep you out of an emergency department if your child starts to have severe constipation while on a trip.
Well, Dr. Hunter, thank you for bringing up that final bit of information. That's probably going to be very helpful for a lot of parents. And happy holidays to you. Thank you so much for bringing these tips on travel and advice to us today.
Happy holidays to you too.
And thank you all for watching as well. Don't forget, you can check out our website. It's hopkinsallchildrens.org/newsroom, and you'll find a lot of other great resources there, like patient stories and other timely topics in pediatric healthcare. We'll see you next week.